Hello folks, welcome back to the circulation unit in Anatomy and Physiology 12. This video will look at the second lesson, cardiac cycle, which is going to talk about the heartbeat and how that works. And then we're also going to look at blood pressure. Under pressure, do 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 do. Sorry, makes me want to sing. Okay, let's jump into it. So lesson 1, we looked at heart structure. We talked about the flow of blood through that heart. We talked about valves. We talked about chambers. We're going to see a bunch of those again. You can find this in the, just like PowerPoint that's posted on the website. I've got this as a slide. If you type that into YouTube, you will get, I can't show you here because I can't capture video of a video, but it's a really cool one of a turtle heart that's been removed from a turtle, and it's in a fellow's hand, and the heartbeat is it's just going. Like the heart is just beating, even though it's been removed from the turtle. You can't even see the turtle anymore. And it's super cool. You can see the atria contract, and then the ventricles. And then the atria, and then the ventricles. And then the atria, and then the ventricles. So it turns out your heartbeat will sort of occur outside of your body until you run out of ATP. And again, I wish I could show you here, but this is an old computer and it won't, like I say, do video of a video. But it's worth checking out. So turtle heart, and it just beats in a person's hand. It's crazy. But let's talk about that heartbeat. Your heart's probably beating about 80 times, 60 to 80 times probably per minute right now. That's probably a little bit more than once a second. So let's talk about that. So as biologists, we're going to go a step further here. The heartbeat is actually called the cardiac cycle. And there are 3 parts to each cardiac cycle, or each individual heartbeat. The first thing that happens is your 2 atria. Remember, those are the top 2 chambers that aren't as muscular. They both are going to contract together. So they both squeeze the top 2 chambers. That forces blood into the ventricles. Then the ventricles are going to contract. They're going to squeeze, and both sides together. Remember, that's going to force blood to the lungs from the right ventricle, and then to the rest of the body through the aorta from the left ventricle. So they're going to contract, and then they all relax. And you can see in this picture here on the side that it takes about 1/10 of a second for the atria to contract. And then it takes about 3/10 of a second for the ventricles to contract. And then it takes about the same amount of time as those two together, about 4/10 of a second, for everything to just rest. So this is showing your, again, I said probably about 80 beats per minute, and that's about how long this whole cardiac cycle would take then, if it's more than once a second. So during a heartbeat, and I'm saying that in air quotes, your muscles, your heart muscles, the atria and the ventricles, are actually only contracting for half of that time. And then they spend half the time relaxing. That allows the atria to fill up with blood again. They squeeze the blood into the ventricles. The ventricles squeeze the blood to the lung and the bodies. They relax. The atria fill up again. And that cycle continues. And if you're really relaxed, like for myself, this whole cycle is going to take longer. My resting heart rate is just over 40 beats per minute. So that means each half of this circle would be 0.6 seconds. So it's a little bit slower. Although when I'm running, if I get my heartbeat up to, sometimes I'll touch 190 beats per minute, which is actually really high. A lot of people don't go that high, but some people go even higher. Then this whole process is speeding up a whole bunch. There's still relaxation in there for half the phase, half the cycle, but that's not very long in terms of how many seconds. So 2 terms we're going to see here. I'll just bring them both up. Systole, or some people say systole, is when the heart muscles are contracting, and that's half of the cycle. The atria contract, and then the ventricles contract. That's systole. And then diastole, or diastole, is the relaxation phase. This phase right here. And you may have seen those terms before related to blood pressure, which is coming later in this video. Systolic blood pressure is the pressure when your ventricles are contracting. And diastolic blood pressure is the pressure in blood vessels during the rest phase, when the heart actually isn't contracting, when everything's at rest. Just so you know, random Jeopardy fact, people talk about this lub-dub sound, or maybe you've heard it called the lub-dub sound. But if you ever listen to a heartbeat, you kind of, or cardiac cycle, you kind of hear two different noises. A lot of people call it the lub-dub. And that both noises are actually valves closing. So it's not the muscles contracting, it's the valves snapping shut. And remember, those chordae tendineae help keep the two big bicuspid and tricuspid valves closed. The first sound in a heartbeat, the first bump, is the AV valves closing when the ventricles contract. So that's preventing blood from flowing backwards up into the atria. And then the second noise you hear, or you can even feel it if you're taking your pulse, the second one that you feel as well, is when the semilunar valves snap shut. So once the ventricles have contracted, they're forcing blood out the aorta and out of the pulmonary artery. The blood back pressure keeps the pulmonary semilunar valve, makes it snap shut, and also the aortic semilunar valve snap shut. Actually, I guess you can't feel those ones. I should go back and retract that statement. When you're feeling things, you're feeling blood rushing through your, like if you're on your wrist or your neck, feeling for your heart rate. You're not actually feeling the valves snapping shut. You can hear that with the stethoscope, but if you're going to touch your neck or touch your wrist, that's the blood actually pulsing through the blood vessels. So just it'd be what you would hear if you were listening to somebody's chest, but not at their wrist or their neck. So how does the actual heart rate happen, right? Or how does the heartbeat get initiated? And what I want to look at here is something called intrinsic control. So this is sort of just like your body. This is built in. We don't think about that. That's what intrinsic means. It's just happening automatically. Sometimes you'll hear it called autonomic control because it is automatic. You don't have to think about making your heart beat. So the electrical impulses, the nerve impulses that actually make the atria contract and then make the ventricles contract is what we're going to look at over the next few slides. So what we have are these little nodes in the heart. And nodes are some specialized muscle mixed with nervous tissue, mixed with nerves. And there's a couple of them. There's one up on the top of the right atrium. So on the right side at the very top, there's something called the SA node, which is the sinoatrial node. Sino means on top, and then atria. And then there's also another little bit of sort of specialized muscle and nervous tissue right here called the AV node. That's called the atrioventricular node because it's between the atria and the ventricles. So those names kind of tell you where they are on the heart. And what happens here is that the nodes are actually the things that are controlling the cardiac cycle. They control your heart rate. They are the, I'm saying this in air quotes, the pacemaker of your heart. So the first one, the sinoatrial node, that's the one up on the top here. It's actually the one that starts the whole cardiac cycle. It is the true pacemaker. We call it, again, the SA node just for sinoatrial, just to keep things short. And it starts the whole party. It is the thing that controls your heart rate most of the time. I'll throw that in there because we will see there are exceptions. So the sinoatrial node is along the upper wall of that right atrium. And like I said before, it is the pacemaker. It is the thing that actually controls your heart rate. So you want to have your SA node working well, otherwise your heart rate can go awry, and that's not good. You might have to have an artificial pacemaker installed. The atrioventricular valve, also known as the AV valve, the one that's a little bit deeper. I should throw in too, the sinoatrial node, this is probably no surprise, it controls contraction of the atria. And remember, they squeeze together, so both the right atrium and the left atrium are both going to squeeze blood into the ventricles through the tricuspid valve on this side and the bicuspid valve on this side. You can see all the great chordae tendineae that are going to help prevent backflow. So the SA node causes the atria to contract, squeezes blood into the ventricles, and then the atrioventricular node, it sends a nerve impulse down into the ventricles through some nerves that we'll talk about on the next slide, and that causes a nice big contraction of the right ventricle. Blood goes off to the lungs, and the left ventricle, blood goes to the rest of your body, your head to your toes. So that one sits sort of right down towards the center, almost at the crossing, where if you imagine there's sort of a T shape here, it's sort of right in the middle. So here you go, the SA node. It initiates the whole thing, starts the party, contracts both of the atria together. This pushes blood through the tricuspid valve into the right ventricle, through the bicuspid valve into the left ventricle. Those valves prevent any blood from backflowing. So one-way streets, we push blood into the ventricles. Continuing on, just a fraction of a second later, remember that atria contraction takes about 1/10 of a second. Then the nerve impulse is going to travel from the SA node through these nerves into the AV node, and it causes the ventricles to contract. So the AV node causes that ventricular contraction. That forces blood through the semilunar valves, the pulmonary semilunar up to the lungs, and the aortic semilunar valve out to the rest of your body. And when they squeeze, that's when these two big AV valves snap shut. And we mentioned the double beat. Once the blood is moved off to the lungs and off to the body, that back pressure then causes the semilunar valves to snap shut. So that's that double beat, that lub-dub or lub-dup sound, is those valves closing. So the SA node fires, and then the AV node fires. I do want to look just at the AV node. You can see that these nerves, once it sends an impulse to fire, for those ventricles to contract, that nerve impulse actually has to travel all the way down the septum, through these bundle branches, some nerve branches, and then it has to go all the way up the side of the two ventricles, because you want the whole ventricle squeezing. So I love this name. This is called the Purkinje fibers. Somebody with a great name discovered these things. So when that AV node causes the ventricles to contract, it really is sending the nerve impulse into these Purkinje fibers, which are just these nerves that run up along the sides of the ventricles. And it's going to cause those muscles, the myocardium, in the ventricles to do their nice big squeeze. There you go. So Purkinje fibers are what are carrying that nerve impulse through the ventricles. Big push, right? All the way to your lungs and then all the way from your head to your toes. So that is the automatic or autonomic or intrinsic control of your heart rate. So it is really, if I scroll all the way back, it's really all about the sinoatrial node. That is, I'm going to assume that you are healthy just like I am in terms of heart rate. We have functioning sinoatrial nodes, right? Life is good. And that's going to keep your heart rate, especially at rest, doing exactly what it needs to do. Now, sometimes there are instances where you might need to speed up that heart rate, like something startles you, like a fight or flight response. Maybe you've heard about that. Or there are times, like when you're sleeping, when your body just wants everything to slow down. It's like, why beat fast and burn that energy when we don't have to? Let's relax. And that's where extrinsic control takes place. So this might not be a surprise. Hopefully it's not a surprise. The medulla oblongata, which we talked about governing respiration rate. Remember, it was the primary chemoreceptor that's looking for high levels of CO2 or H+, that regulates how fast you breathe. It also helps govern the heart rate. So it doesn't initiate the heartbeat. Remember, that's the job of the sinoatrial node. But the medulla oblongata, just as an analogy, it can kind of talk to the SA node and say, hey, it's bedtime, right? Let's slow down a little bit. So it's like it calls up the sinoatrial node and it can say, let's slow things down. Or if it needs to, it can call the sinoatrial node and it can speed things up as well. So your brain, and again, that part of the brain, the medulla, is still sort of automatic. You're not thinking about increasing your heart rate. It just happens, right? In response to exercise or being nervous, whenever your body needs it to happen. So the medulla can send a signal, probably a hormone. to be honest, but it could be a nervous signal as well. And that can cause your SA node to speed up or slow down. Just to introduce the two systems that whole speed things up or slow things down, that's called the autonomic nervous system. And we're going to spend way more time looking at this in the nervous system unit. But the parasympathetic nervous system is your medulla talking to the SA node to decrease its activity, to slow things down. And that happens at rest. Sometimes you'll hear the parasympathetic nervous system called the rest and digest response. So typically after a meal or when you're resting and relaxing, your heart rate's going to slow down. That's your parasympathetic nervous system slowing the SA node down. And then the opposite of that is the sympathetic nervous system, which is getting that SA node firing more quickly when you're excited. So if you're getting jazzed up for a basketball game, or you're getting ready for a big race or sporting event, or something's exciting and you're looking forward to it, your heart rate goes up, your blood pressure goes up. That's going to be your sympathetic nervous system that's getting that SA node to fire more often, more frequently than it normally would. And then another one, a big one, you guys have heard this I think before, is epinephrine, right? So if something really startles you, your adrenal glands, which sit on top of your kidneys, are going to release epinephrine and norepinephrine, and that like travels in your blood to the SA node, and that is like an instant increase in heart rate. It's the one if you're walking outside and somebody were to jump out from behind a bush and yell at you, epinephrine, boom, there you go, fight or flight response, where you're either going to run away, it's probably what I would do, or you're going to swing for the fences, you're going to throw a haymaker, which sometimes happens. That's the fight response. So your brain can help out with governing heart rate as well, as can the epinephrine, which is a hormone. So typically with that heart rate, you'll have changes in blood pressure as well. So this is something, blood pressure, I'm going to guess, is probably not a huge health issue or concern for people your age. But when you become an old man like Mr. Heinrich, then this is something you have to start paying attention to. So blood pressure is how much pressure there are in the blood vessels when the heart is squeezing. It turns out that the heart itself is really not the thing that you're going to run into issues with when the pressure is high. It's the actual like blood vessels, like the little arteries and veins. They're kind of stretchy and elastic a lot of the time, but over time they can sort of harden and things can burst. It's like a hose bursting, and then things leak. You can have some big blood leaks in your body, and that's really, really bad. It can cause things like strokes or heart attacks, both of which you don't want to experience. So blood pressure, hopefully this makes sense, is the greatest when the ventricles contract. Right? Your left and right ventricles, they do the big push. That's when you're going to have the highest blood pressure. And then your blood pressure actually goes down a little bit when the ventricles are resting. So I mentioned these terms already. When the ventricles contract and you do get that big rush of blood through them, the pressure in the blood vessels would be called the systolic pressure. And this is a little device here, this picture in the top right-hand corner. It's called a sphygmomanometer. Sphygmomanometer. There we go. It's even a mouthful for me to say. So this is what the doctor uses. We actually have some in class. We would be using them today or next class if we were in school, and I wish we were. This is what the doctor is going to use to measure your blood pressure. You can also go to those machines like in London Drugs or Walmart. You go to the pharmacy section, they're kind of cool. But it will tell you what the pressure is when the ventricles contract. That's your systolic pressure. And then your diastolic pressure will be lower. That's the pressure in your blood vessels when the ventricles are at rest. Because you still have blood moving through the blood vessels when the heart isn't beating, when it's resting. There's just less pressure. That's all. The big bulge of blood has gone through, and now there's a smaller amount flowing through. So that's called your diastolic blood pressure. And normally for people, they say the normal range is, it's measured in these millimeters of mercury, kind of strange units, but the regular number is 120 for the systolic pressure and 80 for the diastolic. So 120 when the ventricles contract, and then 80 when the ventricles relax. That's considered normal. If you go above that, then you're into high blood pressure, and when you go below that, you're into low blood pressure. So most of you would probably be around this range. Some of you actually would probably be a little bit lower. I doubt many of you would be high. But sometimes what happens as you age is, especially if you don't exercise very often or your diet is not very good, those numbers can start to creep higher and higher. And then you have to start monitoring that, because too high a blood pressure over time, like I say, can cause things to burst, and that's bad. So blood pressure problems, we'll finish off the lesson with this discussion. It's good to know because you're going to probably run into this discussion as you age. One of the big issues that people have as they get older, and again, this can be genetic, but it's also got a diet component and an exercise component, something called atherosclerosis, which is a really fancy word to mean that you have cholesterols and fats that build up in arteries. And the little cholesterols and fats, they deposit and they reduce the volume. It's like reducing the pipe size, and that increases blood pressure. Those cholesterol and fat deposits are called plaques. So that's how you say that word. And again, if you're reducing the size of the hose, then the heart's going to have to squeeze harder to get the blood through that hose, right? You got to turn the pressure up to get the same amount of flow. So that causes high blood pressure, and it can actually kill the tissues that blood vessel is serving if it's completely blocked, right? If you fully block off the hose and water can't flow through a hose, then whatever's supposed to get watered, if it's a plant, it's going to die. It gets no water. If that blood vessel is serving a muscle of some kind, that muscle could die because it's not getting any oxygen or CO2 removed. So that's the tissue death piece. That's bad. If the buildup occurs in the coronary arteries, because remember, this is kind of weird, but the heart muscles themselves need a blood supply. They need oxygen to be delivered. They need CO2 to be removed. So they've got their own little blood vessels. And if the blood vessels that serve the heart muscles are blocked, then those heart muscles can die, and that's called a heart attack. Right? A myocardial infarction is actually the crazy biology term for a heart attack, and that means part of your heart can potentially die. That's obviously really, really bad. High blood pressure can also cause stroke. This is one that really scares me. Stroke is when you have blood vessels in your brain that have too high a pressure and they burst, and you start to bleed into your brain, and you can have all kinds of issues there. I actually just heard on the radio this morning while I was having breakfast that there is a little mnemonic, and I've totally forgotten it now. I apologize. I need another coffee here. Too early. And I only heard this like hours ago. Oh, Heinrich. There is something about a face and arms. Fast, I think it is. Face. So if you notice somebody's fast, yes. So the F is face. Is their face drooping on one side? Arms. Can they lift both of their arms? Speech. Is it slurred? And T is time. Call for help right away. Yes, I remembered it. My brain does function sometimes. So stroke is kind of scary. Sometimes you can recover from stroke. Sometimes you don't. I have an older fellow that lives down the road from me who's had a stroke, and basically one side of his face and body is never going to function the same. His face is all droopy. He doesn't really have good control of his arms or legs on the one side, and that's because he had a stroke in his brain. Some blood vessel in his brain died or popped, burst, and that killed some of his brain that controlled that side of his body. So very scary. High blood pressure is a major issue for a lot of people. Again, we have become as a society quite sedentary. We don't exercise that much. We have poor diets. That can combine to increase blood pressure. Low blood pressure is less of an issue, although it's genetic. My wife has really low blood pressure. It can sometimes cause dizziness or fainting, fatigue, although you don't meet too many people that suffer from like a low enough blood pressure that it's an issue, to be honest. It would be the better of the two to have if you had to pick one. So my wife, her blood pressure is so low that every time she goes to the doctor, which is not often, but she did have to go a lot when she was pregnant with each of our children, the the doctor would always go, are you feeling faint? And she would say, no. Should I? And they'd go, yeah, your blood pressure is so low that we would expect you to like pass out at this point. So, no, I feel fine. So she just genetically is really low. Her body's used to it. And there are easy things you can do, like adding some salt into your diet that can help bring that blood pressure back up. It's much harder to bring the blood pressure down. Again, there is a little activity I'm going to mention at the end of this video, where if you've got the opportunity, it's fun to measure your blood pressure and see where you're at. So, a high salt diet. This is another thing that's a major issue for high blood pressure. You guys know this, that if you have lots of salt, what does salt do? Well, it draws water. Remember osmosis, right? So if you've got a lot of salt in your blood, it's going to draw a lot of water into your blood, and that's going to increase the pressure in all the blood vessels because you're filling them up with more and more water. So high salt diets can result in high blood pressure. People who suffer from hypertension, which is what we call high blood pressure, quite often need to be very careful about the salt that they consume in their diet. Hypotension is low blood pressure. Hyper means high, hypo means low. And again, it can affect kidney filtration, but I've never met somebody who suffers from low blood pressure. My dad suffers from high blood pressure. My grandparents suffer from high blood pressure. Genetically, I actually have a predisposition for high blood pressure, for hypertension, because I'm quite fit and I'd like to think, a pretty darn good diet. I'm right in that normal range, but I'm sure, so I'm in this range here, that's sort of 120 over 80-ish. If I didn't exercise as much and I wasn't that careful about my diet, my body would want to go into like probably the pre-hypertension stage. And then as I get older, maybe even like stage 1, stage 2 hypertension. And quite often those people, like I say, they have to really watch salt in their diet, and there are other medications they can take that help keep water out of their blood to help bring that blood pressure down. But usually you can fix it with regular exercise and just a healthy diet. So shouldn't be that hard, but it is for people. So there's your blood pressure, and there's different ranges of high blood pressure. Again, stuff to look forward to, in air quotes, when you're old. I do want to show you, hopefully this is going to record okay. Here's the heartandstroke.ca website. So high blood pressure, it says, is the #1 risk factor for stroke and a major risk factor for heart disease. Heart disease is when you plug up those coronary arteries with those plaques, those fatty deposits, and you potentially can have a heart attack. So that's a cool website to check out, heartandstroke.ca, a little discussion about high blood pressure. The other thing that's probably worth watching is on the website, there are some good videos that I've put in there, right here, talking about, there's a really good TED video talking blood pressure. And then there's a little video here, we've talked about heart attack, right, that myocardial infarction, the fancy word. There's a cool TED video there. And then there's a cardiac cycle talking about the electrical impulses, the SA node, the AV node, Purkinje fibers. And then atrial fibrillation is an issue that some people suffer from, where the SA node doesn't fire quite right. It fires irregularly, and you can end up with an irregular heartbeat, which means the ventricles aren't giving nice, big, precise squeezes like they should, and that makes blood flow inefficient in your body, can cause a whole host of problems. But this video is really long, so I'm not going to sort of talk too much about that. I'll let you watch these videos. They're super cool, right? Hopefully you're geeking out. Go watch them. I've watched them many times. They're fantastic. What you'll want to do for practice is down at the bottom of the web page, the assignments and practice. With the circulation, heart rate, pulse and blood, be able to measure blood pressure. If you don't have the right tools, but that's okay. You can certainly measure pulse. There are some questions in this assignment, in this activity, that you will be responsible to know. Questions that I might put on quizzes, right? And the quizzes count. So even if you don't measure your blood pressure, look at the sort of assignment, think about what might happen, and you should be able to answer the questions anyways. So give that a try. If you have questions about any of this, the lesson itself, or anything from these assignments, hit me up in the next Zoom meeting or fire me an email. We'll chat soon.